Hi, ladies. So today we're talking about progesterone and how you make it, what it affects, and it's so important for our health, especially if you're aging 35 plus or you're trying to get pregnant. Oftentimes we only think of progesterone when we're in our fertile years, but it actually is key to your health and maybe some of the symptoms you're experiencing if you're 35 years old or older. So progesterone is produced by the pituitary gland. So the pituitary gland makes follicle stimulating hormone and luteinizing hormone. And these are responsible for making estrogen and progesterone. And some women start to see a decline with progesterone around 35 years old. And progesterone prepares your body for pregnancy when you're in your fertile years, but it does a lot more than that. So with that decline, I give you that age range because 35 plus, like if you start to resonate with some of these symptoms, then that could be an indicator that your progesterone may be low. So this phase where your progesterone is lowering typically indicates perimenopause. So it ushers in this season of perimenopause and then eventually menopause. It can last for months to years. So it just really depends on the individual. And in this season of life, you may start to notice you don't handle stress well, you get overwhelmed easily, you're easily irritated and anxious, and maybe you're experiencing some insomnia, poor sleep. These are all things that are indicative of low progesterone. One thing that can help with that is GABA supplementation. So because progesterone acts on GABA receptors in the brain, it works really well. And GABA is responsible for kind of making us feel peaceful and calm. And that's why typically if you're making a normal amount of progesterone, that time of your cycle, you should sleep better and feel less anxious, less wound up. So you may also notice with low progesterone or going into those perimenopausal years that you notice that you just don't have the drive that you used to. So lack of drive, low libido, so low sex drive, and poor concentration. The way perimenopause starts is with shorter cycles. So maybe you have always had 30-day cycles and you start to notice that they get shorter. So maybe they're 28 days, 27, 26. This is kind of the first phase. And then they become more regular. So maybe you start missing. So every other month or every 2 months. And so that's a good indicator that, hey, you know what? You're not ovulating every month. And then you start to experience symptoms such as hot flashes, night sweats, low libido. And then you start skipping more periods. So maybe 3-4 months down the road, maybe you're starting to experience painful sex from, vaginal dryness. And then eventually you start to go 6-7 months. And this is an indication that you're headed right into menopause. So that's kind of the phases and what that looks like. Now let's talk a little bit about the imbalance, like the lows and highs and what those look like a little bit more. So symptoms of low progesterone can manifest in a lot of different ways, but I'll give you just a few of the symptoms that maybe you might be experiencing. Things like if you're young, in your 20s, 30s, maybe you're having ovulation problems. You're not ovulating regularly. You're having infertility, breast tenderness, depression, anxiety, fatigue. Like I said, you're not able to concentrate as well. You might be experiencing sugar cravings. Maybe you're having fibrocystic breasts, PMS, really bad mood swings, PCOS, so the polycystic ovarian syndrome, headaches, bloating, and weight gain. So those are all symptoms of low progesterone. On the flip side, which is maybe a little less common with excess progesterone, you may experience the loss of muscle tissue and muscle strength, decrease in growth hormone, high cortisol levels in the blood, low calorie expenditure, weight gain, estrogen deficiency, because progesterone drives down estrogen, right? When estrogen's up, progesterone's low. When progesterone is up, estrogen's typically low. And So those are some of the symptoms of high and low levels, but I can't stress this enough. Stress and thyroid dysfunction, really stress, because stress drives down thyroid hormone. So stress is one of the main drivers of low progesterone in women. Under stress, what happens is cortisol steals the precursor hormone pregnenolone from DHA and progesterone to make cortisol, okay? So your body, when in a stressed state, downregulates those sex hormones, so specifically your progesterone. This is called the pregnenolone steal. And like I said, pregnenolone is a precursor hormone to estrogen, progesterone, testosterone, and DHEA. We have to have pregnenolone to make progesterone. So, and stress is the main driver. So no matter what your diet looks like, your exercise, if you're stressed out, it is going to drive down progesterone, and I'm speaking from example. And then your body it's important to know when, right, during the month your body is making progesterone. It makes progesterone the second half of your cycle. So after you've ovulated, you make progesterone. And keeping in mind that progesterone goes down when cortisol is high, this second half of your menstrual cycle is where you really want to avoid as much stress as possible. So if you can take it easy, say no to more things, relax, sleep more, sauna more, walk more. And then also things that we don't think of that cause stress on our body are things like the ketogenic diet, extended fasting, and I'm talking like 15 plus hours, or any excessive low calorie, low carb diet will drive down progesterone. Okay, progesterone is very sensitive to stress. And so just being aware of where you're at in your cycle. So I would encourage you, if you're not tracking your cycle, start tracking it today. It is going to be so helpful as you age, no matter like how old you are, start tracking it. And then let's talk about like some things that you can change in your diet that will help support progesterone. So our bodies have to have carbohydrates to make progesterone. But when I say carbohydrates, I'm talking about whole food carbohydrates, okay? Things like root vegetables, cruciferous vegetables like broccoli, kale, Brussels sprouts, cabbage. Sunflower, flax, and sesame seeds contain vitamins and minerals that we need to make progesterone. Citrus fruits, chickpeas, kidney beans, and black beans, and those are if you can tolerate them, right? If you have a healthy gut microbiome and you tolerate legumes, then you can have those. If not, I would encourage you to stay away from those. But women who are experiencing severe symptoms or who just want to prevent severe symptoms, if you're, in your 40s, you need to get your blood work done first. Get your levels checked first. Don't start supplementing with things. Go get your levels checked. Test, don't guess. Remember, progesterone, like I said, downregulates estrogen. So if you are going to your doctor and getting labs to find out what your levels are, it is important that your doctor is testing you at the right time in your cycle to get the big picture of what your hormones are doing. Because if they check your progesterone at the beginning of your cycle when you're making estrogen, of course it's going to be low. So you need to make sure that your practitioner understands what they're doing. And if not, I would encourage you to find a holistic practitioner or a functional medicine practitioner to do that. And then another question I do get asked frequently is on hormone therapy, so bioidentical hormones. And these are typically different than just like birth control hormones, right? Like those are synthetic, like progestin. That is not the same. I am talking about bioidentical progesterone, either in cream or oral form. And it's typically very safe and it's very effective, especially if you're not sleeping well or you're very irritable and having issues with moodiness. A bioidentical hormone can really help reduce those symptoms. And then a natural supplement that is really good for progesterone is Vitex. It's chaste tree. So it's pretty safe, and you could take it, on the second half of your cycle, depending on how low your levels are. Again, you need to get it checked. None of this is medical advice, and you need to, like I said, see your practitioner, get your levels tested to find out where you were at. But typically, if you're 35 plus and you're experiencing some of these symptoms, it could be low progesterone. So that is kind of in a nutshell progesterone. I hope that kind of helps you understand what your body is doing in the second half of the cycle, or even in perimenopause going into menopause. And as usual, if you have any questions, just send me a message.